Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What helps stress incontinence and what makes it worse? Stress incontinence is a type of urinary incontinence in which a small amount of urine, pee, leaks out whenever you cough, laugh, sneeze, or do any physical activity that exerts pressure on the bladder. /r/n/r/n. Fortunately, you can do things to help manage this common but aggravating condition, including making changes in diet, performing certain exercises, losing weight, and wearing bladder control pads. Severe cases may require specialist treatment, including a type of surgery called a sling procedure. /r/n/r/n. This article describes the causes and risk factors for stress incontinence, including how the condition can be managed with lifestyle changes, medications, and surgery. /r/n/r/nLordn. Getty ImagesrnrnrnVerywell Health acknowledges thatsex and genderare related concepts, but they are not the same. To accurately reflect our sources, this article uses terms like male, female, men and women as the sources use them. /r/n/r/n. Stress incontinence is not caused by emotional stress. It occurs with weakening of the muscles that support the urethra, the tube through which urine exits the body. /r/n/r/n. This includes the urethral sphincters, a pair of muscular valves that regulate urine flow from the bladder to the urethra. /r/n/r/n. It also involves the pelvic floor muscles situated between the genitals and anus that you voluntarily squeeze to slow or stop peeing. /r/n/r/n. If these muscles weaken, any external pressure on the abdomen can squeeze urine out of the bladder, causing dribbling and leakage. /r/n/r/n. Physical activities that cause stress incontinence include /r/n/r/n. Studies suggest that between 15% and 35% of adults experience urinary incontinence. Stress incontinence, the most common type, affects females at a rate 3 times greater than that of males. /r/n/r/n. Certain factors can increase the risk of stress incontinence. These include conditions that exert pressure on the bladder and others that damage the nerves that control the urethral sphincters. /r/n/r/n. Risk factors for stress incontinence include /r/n/r/n. Risk factors specific to females include /r/n/r/n. Risk factors specific to males include /r/n/r/n. Stress incontinence can happen at any age but tends to occur slightly more frequently in females between the ages of 41 and 55 than those between the ages of 25 and 40. /r/n/r/n. It is not uncommon for stress incontinence to co-occur with other forms of incontinence, such as urge incontinence. Urge incontinence is when you have the sudden, uncontrollable urge to pee before the loss of bladder control. /r/n/r/n. This cooccurrence, known as mixed incontinence, affects nearly 1 in 3 people with incontinence. Mixed incontinence is harder to treat, and it has a higher risk of recurrence than stress incontinence. Ni, 41% versus 31%, respectively. /r/n/r/n. This is why it is important to get an accurate diagnosis from a specialist called a urologist or obstetrician-gynecologist, OB/GYN, to ensure that the right treatments are dispensed. /r/n/r/n. Other forms of incontinence include overflow incontinence, in which the bladder overfills and leaks without the urge to pee, and functional incontinence, in which physical or mental limitations affect your ability to get to the bathroom on time. /r/n/r/n. One of the best ways to treat stress incontinence is with exercises that strengthen the pelvic floor muscles. Doing so can help prevent dribbling even if the urethral sphincters are weak. /r/n/r/n. Kegel exercises, first described by American gynecologist Arnold Kegel in the 1940s, are central to strengthening the pelvic floor muscles. The exercise generally consists of 3 sets of 8 to 12 contractions held for 8 to 10 seconds, performed 3 times daily. /r/n/r/n Other exercises that target the pelvic floor muscles can also be added. /r/n/r/n Kegel exercises can be done by people of any sex, but they need to be performed correctly to target the right muscles. You can do them in any position, although some people find it easiest to lie down when first starting. /r/n/r/n To do Kegel exercises, /r/n/r/n squats are excellent because they engage your core muscles and the muscles around your pelvis. Keep your buttocks and pelvic floor muscles tight throughout the movements for the best results. /r/n/r/n To do squats, /r/n/r/n bridges are a type of floor exercise that can strengthen your gluteus, buttock, muscles in addition to your pelvic floor muscles and lower back. /r/n/r/n To do the bridge, /r/n/r/n research issued by the National Institute of Health and Care Research reported that 2/3 of women with stress incontinence experienced an improvement or resolution of their symptoms with routine pelvic floor exercises. /r/n/r/n Certain dietary and lifestyle changes can help reduce the severity and frequency of stress incontinence. Key to this is the management of fluids, losing excess weight, eating the correct diet, and quitting cigarettes. /r/n/r/n Incontinence is more likely when your bladder is full. While it is important to stay well hydrated, you can avoid bladder leakage by taking regular sips of water throughout the day rather than drinking large amounts all at once. /r/n/r/n You should also limit the intake of alcohol, which has a diuretic effect, meaning that it promotes urination. Caffeine in coffee, black tea, and colas has the same effects and can also trigger bladder contractions. Fizzy drinks may be problematic if you have mixed incontinence. /r/n/r/n It's important never to deprive yourself of fluids as this can lead to constipation. Chronic constipation and straining can weaken the pelvic muscles and make stress incontinence worse. /r/n/r/n Obesity contributes to stress incontinence in 2 ways. First, the added weight weakens pelvic floor muscles. Second, it increases visceral fat surrounding abdominal organs, making it easier to compress the bladder when bending, moving, or engaging in physical activities. /r/n/r/n Weight loss, combined with pelvic floor exercises, can help reverse these issues. Work with a healthcare provider to design a sustainable program involving routine exercise and a nutrient-rich, low-saturated fat diet. /r/n/r/n Studies have also shown that moderate physical activity decreases the risk of urinary incontinence in middle-aged and older women. Almost any type of exercise can help strengthen pelvic floor muscles, including swimming, walking, and cycling. Try to exercise on most days of the week. /r/n/r/n Although there is no such thing as an incontinence diet, studies have shown that stress incontinence is strongly linked to a high consumption of saturated fat. Saturated fats are those derived from animals, including meat and dairy products. /r/n/r/n Along with avoiding alcohol and caffeine, cutting back on fatty red meat, full-fat dairy, and processed food rich in saturated and trans fat can be an important part of the treatment plan. /r/n/r/n A Mediterranean diet rich in fruits, vegetables, fish, and extra virgin olive oil may also be effective for people with mixed incontinence. /r/n/r/n Smoking is well known to contribute to urge incontinence by irritating the bladder, but there is also evidence that it can indirectly promote stress incontinence as well. This is because heavy smoking is linked to a chronic cough, which, in turn, places stress on the pelvic floor muscles that can weaken them over time. /r/n/r/n Quitting cigarettes can be tough, but smoking cessation aids can help. Many of these aids are fully covered by insurance under the Affordable Care Act. Speak with a healthcare provider. /r/n/r/n It is important to note that some of the measures used to treat urge incontinence or overflow incontinence may not help if you have stress incontinence. Speak with a urologist to find the plan that's right for you. /r/n/r/n When lifestyle changes and exercise fail to control bladder leakage, prescription medications and specialist procedures may be recommended. These include surgeries typically reserved for more severe cases. /r/n/r/n In the United States, no medications are specifically approved for the treatment of stress incontinence. /r/n/r/n With that said, some healthcare providers may prescribe a drug called Cymbalta, duloxetine, as an alternative to surgery for women with severe stress incontinence. The drug, approved for such use by the European Medicines Agency, has been shown to cut the frequency of stress incontinence episodes in women. /r/n/r/n Even so, some experts suggest that the risks of treatment may outweigh the benefits. Among other concerns, studies suggest that Cymbalta may increase the risk of suicidal behaviors in women with stress incontinence. /r/n/r/n Several minimally invasive procedures can be used to treat moderate to severe cases of stress incontinence. Some have proven highly effective and may help you avoid more invasive procedures like surgery. /r/n/r/n Some of these options include /r/n/r/n When conservative treatments fail to provide relief, surgery may be a reasonable option. 4 types are commonly used for people with stress incontinence. /r/n/r/n The risks of surgery for stress incontinence include postoperative infection, urinary tract infections, difficulty urinating, and injury to nerves or blood vessels of the bladder. /r/n/r/n Some people may also have continued incontinence, while others may experience new incontinence, including a nerve-related form of incontinence called neurogenic bladder. /r/n/r/n Stress incontinence can take an emotional toll on your life, causing discomfort or anxiety that can lead to social isolation, depression, and a reduced quality of life. Some studies have shown that stress incontinence can directly interfere with work productivity and influence key career decisions, such as whether to start a new job. /r/n/r/n Stress incontinence can also impact sexual relationships, particularly among women. This can contribute to a reduction in the frequency of sex or lead to the complete avoidance of sex. This appears to be irrespective of how long or recently the condition occurred. /r/n/r/n Stress incontinence can also affect physical health. Exposure to urine can cause skin irritation, and repeated and ongoing exposure can damage tissues by changing the skin's pH balance, acidity and alkalinity. This can make the skin more permeable and vulnerable to infection. /r/n/r/n Possible complications of stress incontinence include /r/n/r/n There are ways to cope and live well while finding an effective treatment for stress incontinence. Planning is key. /r/n/r/n In addition to Kegel exercises and changes in diet, people living with stress incontinence will often recommend the following to reduce anxiety and stress. /r/n/r/n Stress incontinence is caused when a physical activity like laughing, sneezing, or lifting heavy objects causes you to leak a little urine. Females are more vulnerable to stress incontinence, as are people who smoke, have obesity or diabetes, or have conditions that cause chronic coughing. /r/n/r/n Stress incontinence can often be effectively managed with Kegel exercises, fluid management, weight loss, changes in diet, and smoking cessation. If needed, medications like Cymbalta, devices like vaginal pessaries, or specialist treatments like urethral bulking can be used. Severe cases may benefit from surgery, most commonly a mid-urethral sling procedure. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.